So today my topic is contagious agalactia. The contagious agalactia was first identified over 200 years in the past and referred as a multi-etiological disease syndrome of sheep and goat. It is characterized by trichomastitis, arthritis, keratoconjunctivitis. Occasionally, it may be seen respiratory and reproduction tract disorders. It is one of the costliest production disease of small ruminants. It is widely distributed and it causes severe economic losses in the countries. The causative agent of disease in Mycoplasma agalactia was firstly isolated by Brider and Donation in 1923 as a second recognized Mycoplasma species. It's a name Mycoplasma agalactia given by the prudent. The other members also incorporate, they like Mycoplasma capricolum, subspecies capricolum, Mycoplasma mycoides, subspecies mycoides, and Mycoplasma putrefacciens. As you seen in the picture, the Mycoplasma refer to a genus of bacteria which have lack of cell wall, and it is currently the considered as the smallest known cell at about 0.1 micron in diameter. Its colony resembling a fried egg-like on solid agar media as a result of growth of the center portion, as you see, of the colony into the agar and surrounding light area of surface growth. On the basis of the epidemiology, Mycoplasma agalactia has been reported to be isolated from different parts of the world in various countries like India, Australia, Turkey, Iran, Mongolia, Nigeria, Iraq, and Spain. Apart from above, it has been also reported from various regions in countries like Bulgaria, Serbia, Sudan, Russia, Asia, and Switzerland. By the end of 19th century, the disease had become endemic in many parts of the world. It has been shown that the animal species such as cattle, camel, and small wild ruminant can function as infectious reservoir for Mycoplasma, and the presence of asymptomatic carrier in the herd appear to a serious risk problems. In India, various states like Himachal Pradesh, Jammu, Kashmir, Uttar Pradesh, and Rajasthan, Tripura, Madhya Pradesh, in this state may also be outbreak of the Mycoplasma may also be reported. On the basis of the transmission, the disease is rapidly spread by contact between the infected and healthy animals. The dissemination of the microorganism into the environment occur by means of ocular or nasal discharge, milk, feces, urine, and excretion from the open joint lesions and the urogenital tract. The young animal become directly during suckling and adult by means of milker hand, and bedding contaminated with infected milk may also be source of transmission of the Mycoplasma. Disease is observed early in the spring when the kidding occur and the females are in full lactation and the goat graze on pasture. A further increase in the number of infected goats is recorded by the beginning of summer when the young goats are very sensitive to infections. The disease in herd can persist for several months unless adequate measures are taken on time. The introduction of carrier goat into a healthy flock may also be responsible for transmission of the infection in we can say, the immunocompromised animals. The causal agent may also be spread by feed and footwears. The main reservoir of Mycoplasma are infected goats, feed in which bacteria can persist after clinical recovery from 1 year to other. Such goats are inapparent source of the infections. On the once infection is set up, the fever is observed, and the after the multiplication of the bacteria may take place, or through circulation it reach in different body parts like lungs, lymph node, eyes, and joints, and connected tissue of the mammary gland. Here it produces initial inflammation, which ultimately turn in catarrhal and or parenchymatous mastitis, leading to atrophy and agalactia. Generally, the symptoms are seen in two forms, acute and chronic form. In acute form, this is a rare than the chronic form, and it is found in flock recently infected before there has been a opportunity for immunity to develop. Less than a week, the goat are affected by hypothermia, inappetence. Generally, pregnant does near full term may abort. Some goat may die without showing any sign of symptoms. After a few weeks of illness, the remaining animal will recover, but sequelae, particularly mastitis and milk yield, which is much below the seasonal average, and may act as a carrier for transmission of the infections. In chronic form, where the disease has been endemic for a long time, the generally chronic form observed, the general illness is less severe and may pass unnoticed while the localized form are dominant. The symptom develop progressively but very slower rate. In chronic cases, loss of joint lead to ankylosis. Affection in eye causes severe losses of cornea, ultimately leading to blindness. And keratoconjunctivitis. Affection of genital organ also observed with occasional abortion or stillbirth in pregnant does. The clinical signs, the clinical disease can be manifested as we already discussed, acute and chronic form. There may be fever or a non-specific sign of illness. However, this stage may be mild and it can be overlooked. Anorexia, lethargy, unwillingness to follow the hard and first clinical signs. As you see in the pictures, at the beginning, the adults show catarrhal or parenchymatous mastitis. It is hot, swollen, and tender. Later, it becomes flaccid, filled with connective tissue. Eventually, atopy develops. As you see in the picture, the milk turns into a yellowish that has a salty taste. It can have a watery consistency and when allowed to stand, separate into the other grayish blue and lower yellowish green layer of clots. Milk gradually becomes purulent and at final stage, its production ceases. In case of this slide, conjugation of the conjunctiva and later vascularization of the second corneal surface may be seen. This may be followed by keratoconjunctivitis, keratitis, and loss of sight due to the vascularization of the cornea. Some animals heal spontaneously after a short time, even though they have undergone ulceration of the cornea. Similar to infection with Mycoplasma putrefaciens isolates. In this picture, as you see, the arthritis or polyarthritis occur most often in tarsal and carpal joint and can become chronic. Some animals are muchly stiff, others become severely lame and may be unable to stand or walk. The joint is swollen and painful with accumulation of the synovial fluid. In chronic cases, ankyloma may also be developed and an animal is difficult to move. Diagnosis. Diagnosis of the contagious agalactia is very difficult on the basis of the history. Sometimes those are the animal showing the symptom like conjunctivitis, keratoconjunctivitis, mastitis. In some cases, history may also be helpful on the basis of the clinical science. Laboratory diagnosis is very fruitful for the diagnosis of exact diagnosis of the mycoplasma. For the best test is for biochemical test. The best material for analysis is milk, ocular, vaginal, nasal swab, articular exudate, blood, urine. These are the sample which can be used for biochemical test. Swab taken from the rectum or external auditory canal also prove biological material suitable for the biochemical test. Cultivation is carried out in a liquid or solid media with support mycoplasmal growth. In case of serological test, different serological tests are effective for exact diagnosis of the mycoplasma, like complement fixation test, immunofluorescence test, hemogglutinin test, latex agglutinin test, double immunodiffusion test, ELISA, and PCR. In case of molecular test, the PCR is the best method for diagnosis of the mycoplasma. In some time, Serial test may confuse due to the vaccinated animal or new animal, those are having the infection for mycoplasma. But in case of molecular test, we can say the when we using the specific primer is capable of identifying the majority of the small ruminant mycoplasma, including the all the causative agent of contagious agalactia by their migration pattern. In case of differential diagnosis, agent needed to rule out such as Staphylococcus, Streptococcus in mastitis, caprine arthritis, encephalitis virus in goat joint lesions, Pastula, parainfluenza, and PPR virus for respiratory signs. Other mycoplasma species like Mycoplasma conjunctivae, Mycoplasma capricolum, the causative agent of contagious caprine pleuropneumonia, and Mycoplasma orbipneumoniae in respiratory disease in goat may also be differentiated with the Mycoplasma agalactia. In case of treatment, mostly these mycoplasma are not having the cell walls, so commonly use antibiotic like tetracycline, oxytetracycline more than 15 mg per kg body weight, IM for 5 days, or tylosin at the rate of 10 to 20 mg per kg body weight, IM, is mostly effective drug against the mycoplasma agalactia, along with the antibiotic use of tocopherol at the rate of 2 mg per kg body weight, IM, and sodium selenite at the rate of 0.0 mg kg body weight, IM, may also be effective for controlling the mycoplasma infections. Tylosin with a combination of tocopherol and sodium selenite was found to be most efficacious drug in case of infections. Addition of antioxidants in the therapy increase the efficacy. So it is recommended that when we use the OTC or tylosin, it is better to always given the tocopherol or selenite along with, so they have the increase their efficacy and give the better result. Vaccine nowadays, still in India, the vaccine is not available, but both live attenuated and inactivated vaccines are available for the contagious agalactia. Live attenuated vaccines are more effective and provide the better protection in doe and their kids than the inactivated vaccines. But one drawback is also observed in case of live attenuated vaccine. Those animal produce a transient infection with shedding of mycoplasma through milk. So, however, they are not authorized in many countries and should not be used during the lactation period. So that inactivated vaccines are of greater use due to lack of side effect. So, our conclusion regarding the contagious agalactia, the contagious agalactia has been known for a long time, but still a neglected disease of small ruminants in many countries. Due to the complex disease distribution pattern, ubiquitous nature of the causal agent, and poor goat farm management practices, it remained unnoticed. Rapid spread and multiple sources of infection along with vertical and horizontal mode of transmission are matter of immense concern and severely affect the local economy. Depending upon the conditions, depreciation of metal antibody, immunocompromised state, stress due to the transportation, pregnancy, or extreme climate condition, animal may suffer from acute or chronic or asymptomatic form of disease. The isolation of mycoplasma agalactia is very difficult to separate. Grow serial test can easily identify by mycoplasma agalactia. Systemic use of tetracycline or quinolines group of antibiotic along with local application in advanced stages are useful treatment of a contagious agalactia. Our next topic is contagious caprine pleuropneumonia. So here we discuss the contagious caprine pleuropneumonia is a serious disease of goat, occasionally sheep and wild ruminant, and characterized by severe serofibrous pleuropneumonia with high morbidity near about 100% and mortality 80 to 100%. The etiological agent is Mycoplasma capricolum, subspecies capri pneumoniae, formerly known as biotype F38. Two other organisms in this group, like Mycoplasma mycoides subspecies capri and Mycoplasma mycoides, subspecies mycoides. Large colony type can cause a disease in small ruminants and that resembles CCPV, but may have extrapulmonary signs and lesions. In history, the CCP was first described in 1873 in Algeria. It was not initially recognized as a contagious because the disease was endemic in most of the region. Climate conditions were instead blamed for disease outbreak, but in 1881, there was a major outbreak in South Africa following introduction of diseased goat coming from Turkey, and this led to the conclusion that CCP was the highly infectious. In 1976, the Mycoplasma F30A was isolated for the first time in vitro and was officially named Mycoplasma capriculum subspecies capri pneumoniae in 1993. Economic impact. The goats are important commodities providing meat, milk, and herds, especially in Africa and Asia. When CCP is a disease of major economic importance, when the animal suffering with CCP has both direct and indirect effect on goat population, production, high morbidity rate, and reduced milk and meat productions, and the cost of diagnosis, treatment, and control of all have to direct effect on goat industry. There is also indirect losses due to the implementation of trade restrictions. On the basis of the geographic distributions, the CCP can be found in Africa, Asia, Middle East, Eastern Europe, and the former Soviet Union. It has been never found in the North America. As we already discussed, the CCP is a severe and highly contagious in animal. Morbidity is near about 100%, and chronic disease can also be seen in endemic area where the animal may have pre-existing immunity to Mycoplasma capri. Mortality rate near about 60 to 100%. Close confinement increase the spread of disease. Those are helpful for transmission of the disease in the herd. Animal transmission, the incubation period near about 6 to 10 days, but sometimes it may be seen as 2 to 4 weeks under natural condition. So CCPP is highly contagious disease, and transmission of CCP is by direct contact through inhalation of the infectious respiratory droplets. Chronic carrier sometimes may also be exit, but they remain unproven. In case of CCPP, generally clinical signs are observed related to the upper respiratory tract. Mostly CCPP is strictly a respiratory disease. Peracute, acute, chronic form may also be seen. In peracute form, affected goat can die within 1 to 3 days without minimal clinical signs. In acute disease, the initial signs are very high fever, lethargy, anorexia, followed by 2 to 3 days by coughing and labored respiration. The cough is frequent, violent, and productive. In the final stage of disease, the goat may not be able to move or stand, or its front leg wide and neck extended due to difficulty in respiration. In case of chronic cases, CCPV is characterized by chronic cough, nasal discharge, and debilitation. In case of postmortem finding, the lesion of CCP are limited to the respiratory system. Typical postmortem finding with CCP infections include a granular appearance of one or both the lungs and fibrinous pneumonia, in which the lung is covered with fibrin. There is excessive fluid in the thoracic cavity, as you seen in the picture. Some long-term survivors have chronic pleuropneumonia, chronic pleuritis with encapsulation of acute lesions and numerous adhesion in the chest wall. For the sampling, before collecting or sending any sample from animal with the suspected foreign animals disease, the proper authority like state or federal veterinarians should be contacted, and samples should only be sent under secure condition and to authorized laboratory to prevent the spread of disease. In case of diagnosis, already discussed on the basis of the history of the outbreak and symptom, clinical signs. Those are already discussed, like pneumonia signs and different type of symptoms. Those discussed. In case of biochemical test, we already discussed in case of contagious agalactia, like ELISA, PCR, in that fluorescent test, CFT, hemoglobin test. These are the serological tests which can be used for the diagnosis of the CCPP. Molecular test nowadays very effective for confirmatory diagnosis, PCR. Treatment also the same for the antibiotic can be helpful for treatment of CP like erythromycin, tylosin, tetracycline, or is recommended, but their success depend on early intervention and treatment. In countries that are newly infected, trade and movement restriction and the slaughter of the infected animal is recommended. After the outbreak, quarantine and disinfection should be carried out. Quarantine of the infected flock is desirable, and one-side testing and slaughter is sometimes necessary to control the spread of CCPV. Sodium hypochlorite containing a stop concentration of near about 5.25% available. Chlorine is effective for disinfection, and 0.1% concentration is prepared by adding 30 ml of bleach to 10 gallons of water, which is effective for disinfecting the area surrounding the herd. Prevention is and control for vaccines. Still, India is not having the such type of vaccines. For prevention of the such disease, biosecurity measures to taken on the farm must be sufficiently flexible, appropriate to the type of production and the species concern must also take into account that local circumstances and crucially must be shared with competent authority. Susceptible animals should be identified and animal movement banned from leaving and entering the infected farm, holding, or if the area is difficult to define, then all land with 1 kilometer surrounded the affected farm. The culling of infected animals should be encouraged following normal sanitary arrangement or quarantine. Milk from affected animals should be prohibited from purchase or heat treated. All form of transport used for animal shelters, resting area, milking area, milk storage area, tools like those are using for animals, particular reference to those come into contact with milk should be disinfected following standard procedure using authorized products. Infected and suspected mastitis animal on the affected farm should be isolated immediately in a quarantine area sufficient to prevent contact with other animals. Proper screening of a semen for artificial insemination and bug to be used should be conducted on regular basis. To avoid vertical transmission, those should be vaccinated. In endemic area, vaccination with locally developed vaccine is effectively applied throughout the world. Thank you so much.